Well, some breaking news coming in at a time when positivity rates linked to the Omicron strain of COVID are off the charts in many cases. Very difficult to actually get a clear fix. For example, in Delhi, it's above 18%. But is that the true number? Because testing rates have plummeted. And Omicron itself is not mild by any means. While progression to hospitalization is very low and fatality is even lower, it's not a mild infection, and the long-term impact of Omicron on people around the world not yet clear. The big breaking news story is that the Serum Institute of India, in collaboration with their partners Novavax, are in the process of trialing an Omicron-specific, Omicron BA.5 subvariant-specific vaccine. And if it's cleared by the regulator in India, it could be over here a little after December, but that really depends on when the Indian regulator clears it. It's going to be cleared hopefully in the United States by the FDA over there, the American regulator, in November or in December. Joining us now, the CEO of the Serum Institute of India, Adar Poonawalla. Adar, thanks very much for being with us. What exactly are you collaborating with Novavax on?
So as you may be aware, the BA.5 variant is spreading quite a bit globally. There are a lot of cases in India as well. We are working on a BA.5 variant specific vaccine with Novavax at the moment.
And Adar, when do you expect to have this out in India?
I would guesstimate that we could have a vaccine in 6 months or thereabouts. It's based on the Indian regulators, how quickly they allow us to produce that. The trials with Novavax are underway in Australia as we speak, and probably by November or December, we should be in a position to even apply to the US FDA for that, for the US. Whether we have to do a separate clinical trial in India is yet to be decided. Our teams are talking to the government officials in the coming weeks, and we hope to have a vaccine by the end of this year or the latest, the first quarter of next year. I think this vaccine is important as a booster because although the new variant may not be causing a lot of hospitalizations, it is very serious if you get it. It's like a very, very bad case of the flu, like symptoms that you get, fever, body ache, your throat, and various other symptoms. So it is, in my opinion, important to boost with that vaccine whenever it gets approved and is available.
So that's the big breaking news development, that India could have an Omicron-specific vaccine if that tie-up with Novavax works out. The tie-up will work out, but whether the drug regulator here pushes to get this into India soon, because remember, Novavax is already available here in India. This is a variation of the same drug. Of course, there is a regulatory process, and that regulatory clearance should hopefully come by November or December in the United States. If using emergency powers, it is cleared for use in India, then manufacture of the drug can happen quite soon.